Hi Donna, this is Kim. Today I'm going to be doing my NG insertion, irrigation, and removal technique. Okay, I would have washed my hands, put on clean gloves, explained the process to my patient. I have an emesis basin here with some Kleenex in case he would get sick, a blue check, a glass of water with a straw, a pitcher over here with some water, and okay, I think we're ready to go here. Hi Daniel, this is Daniel, my patient, and I'm going to make sure the head of his bed is at 30 to 90 degrees. And Daniel, we're going to be inserting an NG tube into your tummy, okay, help you feel better. Okay, so first thing I'm going to do is I'm going to assess his nose, check for any polyps, ask him if he's had any nasal surgeries, any indifferences in the openings of the nose. Okay, next thing I'm going to do is I'm going to choose this side here. Next thing I'm going to do is measure the tubing to see how far we need to go down from the tip of the nose to the tip of the ear and all the way down to the xiphoid process. Okay, then I am going to put a piece of tape there. Oopsie. Okay. Alrighty, and the other thing I'm going to do before I start is just curl the end of the tubing a little bit, slightly. That way it will follow the shape of the nasal passageway a little bit better. Okay, so I'm going to put on a lube 3 to 4 inches on the tube. Okay, then I'm going to have Daniel sit up straight, look forward. And Daniel, I'm going to just start inserting this tube into your nose. Okay, the tube doesn't go into the baby's nose, so I'm just going to pretend. Okay, I'm going to insert it, insert it, insert it, insert it until the patient would start gagging or right before. I'm going to hold on to the tube, give him a little break, offer a drink of water, and then if I would have an assistant, I would have them help me with the drink of water too. Okay, and at that time too, I would also look, I would look in the back of his throat to make sure that the tubing isn't curling up in the back of his throat, which it looks good. So we are going to continue. Daniel, you doing okay? Okay, great. Okay, I'm going to continue inserting it, and as I do, I'm going to tell you to swallow. And kind of tip your head forward for me. Okay, here we go. Swallow, 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 all the way down to where the tape is. Okay, now I know we're going to pretend it's in his tummy. So at that point then, I'm going to put a piece of tape here, which I have split the tape, just split the tape in half at the end here so I can wrap around one piece of the tube. Okay, and right now then I'm going to check for placement of the tube. Ouch, dang it. Oh, that hurt. Hold on a minute. I'm going to check for placement of the tube by inserting 5 to 10 cc's of air as I listen to the fundus of the stomach, and I'm also going to be listening for a swoosh, which I did here. Okay, so it's in your tummy. I am also going to aspirate back 5 cc's of content, at which I'm going to test it on my pH strip over here on the table. Okay, good. It's between 0 and 4, which means that's the pH content in his stomach, which we want it to be. Okay. So you doing okay, Daniel? Okay, very good, very good. Okay, so now at this point I am going to hook the suction machine up to the tubing. Okay, I'm going to hook that up there, and then I can also continue to wrap the tape around the tubing because I know it's in place. Okay, making sure my patient is okay. Okay, oops, there. Okay, then I also have a safety pin over here, which I'm going to tape the tubing to his gown with a safety pin and leaving enough slack for him to turn his head back and forth. Okay, then one last thing that I want to do is I'm going to insert 5 to 10 cc's of air into the blue pigtail here, which will pull the tubing away from the stomach lining. Okay, we're good to go, Daniel. Okay, the machine's running. Make sure the patient's comfortable. Give him the call light, and I will check back with you in a little while. Okay, now the doctor has ordered, or no, back up. Now I'm going to, it's the next day, I'm going to do irrigation. I noticed that there isn't any, nothing in the tube. The patient's tummy is distended, so I'm going to check for placement of the tube by inserting 5 to 10 cc's of air. While listening to the fundus of the stomach. Okay, didn't hear any whoosh, so there must be a blockage. Okay, at this time then I'm going to draw up 30 cc's of water, and I would have shut off the suction machine too. And so then disconnect the tubing from the suction machine, and I'm going to insert the 30 cc's of water into the tubing, grasping everything in one hand, holding firmly, and just doing a pumping action until I can get it through the tube. Okay, there it went. So, okay. I would hook this back up to the suction machine, okay, and then getting a clean syringe, I'm going to push 5 to 10 cc's of air through the tubing to make sure the tubing is away from the lining of the stomach. Okay. Very good. You doing okay, Daniel? Okay. Now, always making sure the patient is safe, has call light in reach, head of bed, height of bed is safe. Okay. Next day, hi Daniel, the doctor has ordered for us to discontinue your NG tube. Okay, so what I'm going to do then is shut off the machine. I'm going to insert, oops, I'll just leave. No, hold on a minute. I'm going to shut off the machine, disconnect, insert 5 to 10 cc's of air while listening over the fundus of the stomach. Okay, hearing ball sounds in all 4 quadrants, so very good. I will also aspirate back 5 cc's of content. At which I will check. Okay. It's between 0 and 4, the pH balance, so that's good. Okay. Now, Daniel, everything is it's disconnected from the machine. So now I need to draw 20 cc's of water and 20 cc's of air. Okay, and then we're going to flush out your tubing. Okay, holding my syringe in an upright position. Okay, inserting the 20 cc's of water and the 20 cc's of air. By doing that, the water first and then the air that flushes everything, make sure everything is out of the tubing so the patient doesn't aspirate on any of the liquid from his tummy. Okay, leaving syringe hooked onto the tubing, I'm going to disconnect it from his gown. Take the tape off, and then as I start, I'm going to ask Daniel to take a deep breath and hold it as I pull out the tubing out of his nose, hand over hand over hand over hand, putting everything inside the blue chuck, wrapping it all up. Okay, throwing that away. Okay, making sure Daniel's all right. I would do good oral cares on him and make sure he's safe, call light in place, head of bed, height of bed where it should be, and then I would go and do my DARP charting. Okay, thank you.